there are two big problems. One is that you got to make certain that everybody has health insurance. And as a conservative, I believe the way that you do that is to make it so that it's financially feasible and attractive and foolish for everybody, anybody, not to have health insurance. You do that through the tax code, process of tax deductions, tax credits, tax equity for the purchase of insurance, pooling mechanisms so people can purchase insurance with the purchasing power of millions as opposed to just one individual out there in the individual market. That's the first. Everybody's got to have insurance. Second is that they need to own that insurance through a defined contribution mechanism so that patients have power and control. Right now, patients don't have any power and control in the system. Physicians don't either. But if we put the power and the control and the decision-making in the hands of patients, who along with their families and physicians will be able to answer the questions, as opposed to in the hands of the government or insurance companies. That's the difference between the two parties. Because there isn't a single American out there, I don't believe, who thinks that we ought to give to Senator Obama and Senator Biden and the federal government the ability to make those personal health care choices. I think one of the positive things that we could do, and that I'm urging Senator McCain and his group to do, is to bring about health courts. Make it so that there are specialized courts for trying issues that relate to malpractice. Nobody believes that folks who are inappropriately wronged and harmed in a medical situation ought not have redress in the courts. What we do believe, however, is that our current system is a lottery system. It's a mentality that allows individuals to access the system and kind of roll the dice. And what that does is increase the cost of health care for every single American.
We believe that you can allow provide for a guaranteed program with no changes in the current Medicare system for those over the age of 55. And for those under the age of 55, when they reach retirement age, they'll be able to either stay on Medicare, get on Medicare, or they can choose a plan that's more responsive to their needs. That's the kind of choices that we believe ought to be involved in the healthcare system, and it's the only way that we can save, strengthen, and secure Medicare.
The American people understand and appreciate that the path that we're on in terms of healthcare is the wrong path. Accessibility to the kind of care that people want is going down. Affordability is being destroyed. Choices of patients are being destroyed. Quality of health care is being harmed. And so they understand that something else needs to be done. Something different needs to be done. And that's why I'm so appreciative of Donald Trump and what he has put together in terms of his vision. The biggest vision that he has in the area of health care is that patients and families and doctors need to be making these decisions and not anybody else. And that's the number one issue that is so important to the American people. So when you look at the policies that would flow from that, it means that the regulatory oppression that's occurring in the area of health care right now would be pushed to the side by President Trump. And I'm so enthusiastic and supportive of what he's trying to do, especially in the area of health care. What President Trump will appreciate when he's in the White House is that those programs are going broke, that they're not able to provide the services and the benefits for the individuals who've been promised by this nation that they would receive those benefits. President Trump is going to appreciate that and recognize that the way that you get those things back on track is to fall back on those principles of health care. And that is, we need a system for seniors and for indigent in this country where they have access to the kind of care that they want, not that the government forces them to buy or move into. It ought to be affordable. Nobody ought to go broke paying their medical bills. This is craziness. The quality ought to be the highest ever, and to do that, you've got to have innovation. And then patients need choices. Seniors need choices. Folks in the lower end of our economic spectrum need choices. Every American needs the choices about who's going to take care of them when, where, and how. And that's what Mr. Trump appreciates.